Today's drug is Rosuvastatin, brand name Crestor. The therapeutic category is that it's an antilipemic agent, more specifically an HMG CoA reductase inhibitor. Dosage form and strength. The medication comes as a tablet in a 5 mg, 10 mg, 20 mg, and 40 mg strength. It also comes as a capsule, as a sprinkle, in a 5 mg, 10 mg, 20 mg, and 40 mg strength. Indications and dosing for adults. The first indication is for various forms of dyslipidemia. The general dosing range is between 5 and 40 mg by mouth every day. When initiating, start between 10 and 20 mg by mouth every day with a max of 40 mg per day. Dose adjustments are made every 2 to 4 weeks. Consider lower initiation doses of 5 mg by mouth every day in Asian patients due to the risk of increased drug levels. The next indication is for homozygous familial hypercholesterolemia. The general dosing range is between 20 and 40 mg by mouth every day. When initiating, start at 20 mg by mouth every day with a max of 40 mg per day. Dose adjustments are made every 2 to 4 weeks. Consider lower initiation doses of 5 mg by mouth every day in the Asian population due to the risk of increased drug levels. The next indication is for cardiovascular event prevention. The general dosing range is between 5 and 40 mg by mouth every day with similar dosing initiation, adjustments, and cautions as previously mentioned. The next indication is for atherosclerotic cardiovascular disease, or ASCVD for short. General dosing range is between 5 and 40 mg by mouth every day, with similar dosing initiation, adjustments, and cautions as previously mentioned. It's best to follow the most current ACC/AHA cholesterol guidelines when treating ASCVD. There is an off-label indication for transplantation, post-heart or post-kidney. Rosuvastatin was found to be effective in reducing cardiac allograft vasculopathy and improve long-term outcomes and reduce cardiovascular events following kidney transplantation. Indications and dosing for pediatrics. The first indication is for heterozygous familial hypercholesterolemia. For the age range of 8 and 9 years old, dosing begins at 5 to 10 mg by mouth every day with a max of 10 mg per day. Dose adjustments are made every 4 weeks. Consider starting at the lower end of the dosing range in Asian patients. The next dosing range is between 10 to 17 years of age. Dosing begins at 5 to 10 mg by mouth every day with a max of 20 mg per day. Dose adjustments are made every 4 weeks. Consider starting at the lower end of the dosing range in Asian patients. The next indication for pediatrics is homozygous familial hypercholesterolemia. For the age range between 7 and 17 years old, the common dose of 20 mg by mouth every day is used, and consider 5 mg by mouth every day in Asian patients, which is that lower end of the range. Mechanism of action and pharmacology. The mechanism of action for rosuvastatin is through the inhibition of cholesterol synthesis by inhibiting HMG CoA reductase. HMG CoA reductase is the rate-limiting enzyme in cholesterol synthesis. 10% of rosuvastatin is metabolized hepatically via the CYP2C9 pathway. 90% is excreted unchanged fecally. The onset of action occurs within 1 week with the max effects at 4 weeks. The time to peak in plasma is between 3 to 5 hours. Half-life elimination occurs in about 19 hours. And rosuvastatin is 88% protein bound. Special populations and considerations. In patients with renal impairment, if the creatinine clearance is less than 30, the initiation dose is at 5 mg every day with a max of 10 mg per day. If the patient is on hemodialysis, initiate the dose at 2.5 milligrams by mouth every day with a max of 10 milligrams per day. In patients with hepatic impairment, the medication is contraindicated if active hepatic disease or unexplained LFT elevations. Some groups in which the medication is contraindicated or exercise caution is in pregnancy, myopathy, unexplained LFT elevation, alcohol abuse, 65 years of age or older, Asian patients, females of reproductive age, renally and hepatically impaired, diabetic, and patients with hypothyroidism. Regarding pregnancy, it should be avoided if possible. Discontinue use 1 to 2 months before conceiving. In lactation, the medication should be avoided when breastfeeding. The drug is excreted into the milk. A race consideration specific to Asians is there are increased drug levels, and with those increased drug levels comes a risk of toxic effects. Side effects. Some general side effects are headache, myalgia, abdominal pain, nausea, dizziness, constipation, insomnia, gynecomastia, cognitive impairment, and the development or worsening of diabetes. Some general cautions are for mild memory issues and confusion. Some serious side effects are foamy urine, which could be a serious kidney issue. Muscle pain, tenderness, weakness with fever could be a sign of rhabdomyolysis and autoimmune myopathy. Drug interactions. Some of the characteristics for drug interactions is rosuvastatin is a BCRP substrate, an NTCP substrate, an OATP 1B1, 1B3, and 2B1 substrate. It is also gastric pH sensitive, and there is also a concern for rhabdomyolysis. Examples of some drugs to avoid are cyclosporin, fenofibrate, and gemfibrozil. Some drugs to monitor or modify treatment on are atenolol, betaxolol, clopidogrel, daptomycin, ezetimibe, and warfarin. Monitoring parameters. A baseline should be taken for the creatinine, liver function tests, and creatinine phosphokinase. Patient counseling information. Rosuvastatin is used to lower bad cholesterol like LDL and triglycerides, and then increase good cholesterol like HDL. It is also used to slow the progress of heart disease and to lower the chance of heart attack and stroke. If a dose is missed, take it as soon as you can, but if it is greater than 12 hours, skip the dose. Some of the most common side effects are headache, abdominal pain, nausea, joint pain, and weakness. It is advised to stop for a short period of time if you have uncontrolled seizures, electrolyte imbalances, severely low blood pressure, severe infection, or surgery or medical emergencies.